Okay, so we're going to do a quick little tutorial about some of the main supplements that we keep in the office. And when I talk about supplements, a lot of times people will ask even their doctors if they need vitamins. Well, you absolutely need vitamins because vitamins are the integral parts of all the cofactor workings of the inner parts of all of the systems in your body. So we would die without vitamins and minerals. When people ask the question, do I need supplements? Do I need supplements means, do I need a supplement in addition to what I'm supposed to be getting from my food? So the question is, who actually gets what they need from their food, and who actually eats 10 servings of fruits and vegetables a day? And so even if you do, if you've noticed in the grocery store, even food that you buy, you're going to have a situation where it hardly even tastes like a tomato. You know, it's pale, and they pretty much in the food supply, they grow food on topsoil. So you're not even getting the vitamins and minerals that you would get from deep in the ground. So supplementation, I think, is absolutely vital, especially from an anti-aging standpoint. You know, if you're young and things are cooking along pretty good in your DNA, that's fine. But as we age, those processes really start to break down. I do love the nerdy science of doing testing, like genetic testing for any sort of nutritional deficiencies that you might be prone to, or that you might need to override if you have certain genetic issues. I love lab testing for vitamin D levels, for vitamin B levels, looking at those things so that you know how much you need, because the last thing you want to do is spend a lot of money when you don't need it. The next thing is, when you're trying to be fiscally responsible or a good consumer, you also don't want to take a bunch of stuff that you don't need. So how do you know what you need? I usually say when you feel better, you need it. However, there are some things like vitamin D that are playing under the hood, if you will, that are helping with bone density and helping with your immune system that you might not be able to tell right away. But there are some things like B12 that you take and you have more energy, or things like joint support and you have less achiness or inflammation. So quality matters. That's the reason I formulated my own stuff, because over the years, I know what people need, I know it works, and I'm no guru on supplementation, but I do find that it's very, very valuable, especially if you're not getting what you need from your food supply, and who's going to move out to Montana and grow their own crops, And so anyway, it's called, supplementing life, really, to me. My son teases me. He's like, Mom, why do you take a handful of pills? And I'm like, well, it's a handful of this, or it's a handful of pharmaceuticals. So that's kind of where I start with this. This is not a comprehensive grouping, of course, because there are many, many things, and there are things that are very important and helpful to people that we don't have here. But this is just sort of what we use in general when we're just kind of recommending things. So if you were only going to take one thing on this whole shelf, that would be our Metabolic Pack. And pretty much everything that I formulated in that is, as you would think of like a multivitamin type supplement. Everything from vitamin A, there's some vitamin D in here, and then there's metabolic things in here like the vitamin B breakdowns, things like choline. There's some iodine in here, which helps with thyroid support, things that help with insulin metabolism. So this was sort of just my comprehensive zinc, selenium, copper, magnesium, chromium, all those things that you need to really just maintain the root of your DNA. And then this Multimetabolic Pack is our Carb Melt line, and Carb Melt is our health and wellness line. That's a sort of a sideline that I started that really kind of came out of a focus for weight loss. And so that company, we really focus on the weight loss and health and wellness aspect versus just the kind of core medical type supplements that people need, or what we call nutraceuticals. So the Multimetabolic Pack that's from our Carb Melt line is pretty much like our Multimetabolic Pack in the Dr. Tammy line, only this has some stuff for its active essentials. So it has some other joint stuff like fish oil and some anti-inflammatories and things like that. So this is really good for someone like myself who's got a little bit of time on this planet and some aging joints and that kind of thing. So when we're on the Carb Melt brand here, we also have our fruits and greens. These are absolutely amazing. And the thing I love the most about these is they're not only like 20 plus servings of fruits and vegetables a day, which, if you're not getting all that a day, you'll want to get it through some source. But the thing I like the most about this is that it has digestive enzymes, which helps things break down in your gut better. And digestive enzymes, when they're in supplements, always help those supplements absorb better. And then also it has fiber in it, which can help with absorbing things as well, and it also has probiotics in it, which is what I absolutely love. So I'm real sensitive to different types of probiotics, so getting your probiotic with your fruits and greens just makes sense. This also blends really well with some of our detox powders and things, so lots of different flavors. The more berry ones have the monk fruit in them, so they go well in just water, and they're good for hydration, or if kids like to drink Kool-Aid or something like that. This is the healthy version of that. And then the more chocolatey ones blend in well with any kind of your rice milk or your protein shakes or anything like that. And this is our collagen restore. It has 5 different types of collagen in it. And this is great for crepey skin and for bones and joints, and people have trouble with their hair or nails and things like that. And it mixes really well if you want to go with the health detox. This is actually a protein drink that also has different ingredients in it that help with liver metabolism. So liver is very essential in converting your hormones and helping with your metabolism. And then it also has several ingredients that are very similar to our multi-metabolic packs, like iodine, that help with your thyroid. And at every basically metabolic level, it's got all the good stuff in here. And then all the liver metabolism, like milk thistle, green tea extract. It's got turmeric for inflammation. So this is a great phase 1, phase 2, what we call liver detoxifier. And we have that in chocolate and vanilla, which is great. And then we have the blender. That's wonderful. It's a little frother and makes it really easy to blend all that up. So my daily routine is the chocolate health detox. I do the chocolate mince and greens and a scoop of the collagen powder in there. And I just absolutely love that. One of the things too in our powders is that there's a high amount of glutamine in there, and glutamine acts like spackling. So if you've ever had a hole in the wall and you've spackled over that, and you'll find that the residue on your glasses when you fix this stuff like in the morning, it's kind of hard to rinse off, and it's kind of like, ooh, that's creepy, are you even digesting that? But actually it is that residue that actually helps heal the gut, because it adheres to the gut wall. And with the probiotics, it helps those probiotics get into the gut wall even better. So it's just a really interesting combination blend. We also have the flagship for Carb Melt, our Carb Melt Carb Control, and the Belly Melt. The Carb Control, the main ingredient in that is white kidney bean extract. White kidney bean extract actually helps block the enzymes that break down carbohydrates. So when you eat a complex carb like bread or something like that, as those carbs break down into simple sugars, enzymes do that. So white kidney bean can block up to 30% of the enzymes that break those carbs into simple sugars. If you can't break your carbohydrate, your piece of bread or donut, into simple sugars, it can't get absorbed into the gut, and then it can't be stored as fat. There's also many other things like resveratrol and berberine that all help with insulin resistance, and there's a lot of different mechanisms for that. Women with PCOS who struggle with insulin resistance or metabolic syndrome. My joke about this is when I was trying to formulate this over the years, working with people and recommending supplements for weight loss in addition to metabolic, because I always say weight loss is a side effect of being healthy, right? So you take all the things to get healthy. But as I worked through some of these things, it started accumulating, well, what works for weight loss? What works? And so I call this the kitchen sink. So, if you go at Dr. Oz or you see all the things we're reading and all the things they talk about, I was like, hey, if you put all of that in one thing and all of those things that have good research behind them, we got the kitchen sink, something in there's going to work. So if you're going to, pay good money to have your supplement, you want something that's going to work, something in there's going to work. So that's kind of my thought behind that process. Belly Melt is actually what we call, so Carb Melt's more for insulin. Belly Melt is for cortisol. So there are things like licorice root that help with adrenal fatigue. So any people that struggle with adrenal fatigue and they're tired all the time and their cortisol levels are all over the place, that can help regulate that as well. And then there's also fiber in here, because fiber absorbs dietary fat. And if you can't absorb dietary fat into your body, it's not going to get stored as fat. So that's a couple of different ingredients in there help with that as well. Okay, now we'll go through the Dr. Tammy ones here. Again, I mentioned the Multimetabolic Pack. We have joint support, which has some base things like B12 and folate, and it has MSM, which is an anti-inflammatory. got chondroitin and glucosamine, which some people are familiar with joint support. So I just love this stuff. You can pay a lot of money for joint support. Even at Walmart, I've seen some of these for like $70 or $80. So this is a really good buy for the ingredients that are in there. The estro support is a product called DIM. I won't go into too much detail in there, but the long name is diethylmendolamine, but what it is it's a component in green leafy vegetables that can block the problematic estrogens. So, in our world of hormones, we have good, bad, and ugly estrogens, right? So it can block the conversion into the problematic estrogen. So we can check different estrogen levels in women, especially if there's any concerns about breast cancer or anything like that. And if we have elevations of the problematic estrogens, this stem can be a real key component in reducing their risk from any kind of inflammation or breast disease. And then we have B complex. A good B complex is always going to have all of your Bs in it. So you've got your B12s, your B6, your B9, your riboflavin. This is great for people who have hair loss, can't grow nails. It's got biotin in there, so you can almost call this your hair hoof combination, but it's great too. Fish oil, love fish oil. Fish oil is a great anti-inflammatory. It helps get your good cholesterol up, which lubricates your joints. Inflammation is the name of the game in any disease process. We have reason to believe that up to 90% of all diseases are caused by inflammation. So lots of mechanisms of action in which the omega-3s can decrease inflammation, but also you want good oils in your body to lubricate your brain and your heart and your vessels and everything. So if someone has a lot of inflammation, especially heart disease or joint disease, I usually recommend up to 4,000 milligrams of fish oil a day, which is 4 of these big fat capsules. So I'm not afraid to push the fish oil. Fish oil and vitamin C, though, both can have some potential to affect blood clotting. So it can, quote, thin the blood a little bit. So if you have people who are getting a lot of bruises and taking a lot of fish oil, just like you would have them back off on aspirin or something like that, you do have to watch fish oil just a little bit. The bone support is our solution for our calcium, and you do have to be very careful with taking calcium, especially a menopausal woman, because calcium can deposit in the blood vessels, in the heart, in the breast, in the thyroid. So if you're going to take calcium, you want to make sure your hormones are balanced. So you have to have good estrogen balance, which is why our day job is hormones. But you also have to have vitamin D that actually puts the calcium into the bones or wherever it is that you're wanting the calcium to go, because otherwise you could actually be hurting yourself taking calcium. And this has also got zinc, copper, magnesium, and all the things, the phosphorus and the strontium and boron. And so the bone support plus just means that it's calcium plus all the things that actually help make the bones stronger, not just the calcium, because calcium alone doesn't form those structures in isolation. It has to have those other components to actually build the scaffolding. It's kind of like having concrete without having the water, basically, or the other ingredients that you build your foundation with. Candida complex, we can check candida levels. Candida can cause so many problems. Chronic fatigue, once you have gut flora imbalances, it can cause all sorts of autoimmune things. Most people, especially women, and especially women who have insulin resistance, yeast feeds off sugar. So if you have any kind of sugar imbalances, candida is going to be usually a problem. So if you want to check levels, you can, but there's so many good things in here that just like berberine and things like that, which are also in the Carb Melt. So a lot of crossover with insulin resistance and things like that, but this also has some enzyme blends to help this actually get into your system more. Magnesium, absolutely love this. I've had so many patients over the years who have told me, if nothing else you ever did was tell me about magnesium. Constipation is huge in our society. Multi-billion-dollar industry for constipation remedies. There are pharmaceuticals that, really people just need to increase their magnesium intake. However, unless you're eating really good fruits and vegetables that have a lot of magnesium in it, and again, our fruits and vegetables are depleted in a lot of things that we need anyway, it's hard to get enough magnesium, and almost everybody's magnesium deficient. So on the flip side, you do have to watch getting your bowels too loose with too much magnesium. But if there's a constipation component, you need more water and you need magnesium. People ask how much magnesium. I always say till your bowels are where you need them to be. Magnesium is also a smooth muscle relaxer. So when you are looking at relaxing the bowels, that's how that allows you to not be constipated. But when I was in residency, when women would get high blood pressure while they were pregnant, we would put them on magnesium and not pharmaceuticals because those were dangerous for the baby. So it's a little gold mine of all the things that it can treat. Not telling anybody to stop blood pressure medications, but if you can manage with salt reduction, diet, exercise, and magnesium, that's the way to go for blood pressure instead of being told you have to be on blood pressure pill the rest of your life. So magnesium, lots and lots. Also helps with sleep, very big. It has a lot of mechanisms that it interacts with melatonin and some other hormones in the brain and things like that that can help with sleep as well. Muscles, if you have sore muscles, magnesium, you can do Epsom salt baths, topical magnesium, but magnesium's just, can't say enough about that. 5-HTP. This is a supplement that basically is a precursor to the neurochemical serotonin, which is your happy hormone in your brain. And so if your body needs more serotonin, 5-HTP can be good support for that. If you have somebody that maybe has been on Prozac or Wellbutrin or something like that in their life and they really want to get off that, but they need a little extra support, 5-HTP is good. It's great for sleep. Usually have people take 2 to 4 of these at bedtime. That can be really good. Methylfolate is a B vitamin called B9. It comes from the word folate or foliage from green leafy vegetables and is very different than folic acid. There's a whole nother topic discussion on folic acid versus folate. That is one way, if you want a quick and dirty cheat sheet to know if your supplement manufacturer really knows their business, is if they use folate versus folic acid. Folic acid, think of it like acid, like it's like acid, right? Like caustic. And so that folic acid is a cheap synthetic version that a lot of people can't process, can accumulate as something called homocysteine, inflammatory markers. And if you have any genetic defects that you can't process, folic acid can be very detrimental and can increase your risk of heart attacks and strokes and inflammation and cancer and all sorts of things. So we do a lot of genetic testing here in the office, and we can look at your markers and different pathways, whether you have any sort of folate processes that need extra attention, but it's always safe to go with L-methylfolate, and this is just what we call an isomer, so this is a clean version of folate. And you always want to make sure all your supplements have folate, not folic acid. So if you're going to get yourself a multivitamin from Walmart or something like that, and you see folic acid on there, just walk on by. Also, when you look at, being a good consumer with vitamins, there are lots of companies with GMP practices and things like that. And those, some of the big box stores have gotten in trouble because they have actually tested the ingredients in them and found that none of the active ingredients that actually they were trying to sell were in there. So you always want to go with companies who have those GMP markers or those best practices, and then always look and see if there's anything like shellfish, like our Belly Melt has shellfish in it, and so really it's up to the consumer to make sure that they're reading labels to make sure that there's no problem in there that for them. We have vitamin D. Vitamin D is huge. It helps with the immune system and it helps with mood. In the wintertime when you get the seasonal affective disorder, or you get depressed in the wintertime, most people have low vitamin D levels, and vitamin D puts calcium into the bones as well. And so I like the plus K. We have the vitamin D without the K. The reason we have it without the K is because some people are on blood thinners and, we don't want the K involved in there, but, really you're fine to go with K unless there's some, specific reason not to, but the vitamin D plus K. And then digestive enzymes, these are the enzymes that break down fats, sugars, and proteins. So we call the fats lipase, the sugars amylase, and the proteins proteinases. So these have all of these. So this is sort of a cheat if you have digestive disturbances after you eat and your food's not breaking down for whatever reason. We do food sensitivity testing here, and so I tell people that once you get through your initial detox phase and we get you through that food program, if you're gonna have gluten, if you're gonna have that donut, life happens, right? So digestive enzymes are great to help you digest that when your body's really just not in the mood to do it. If you are familiar with something called Beano that used to be in the stores, B-A-N-O, it's for basically when you eat beans. And so what it does is it breaks down the amylase, which is an enzyme that breaks down the sugar. It's kind of like Carb Melt, breaks down the enzymes. But I always wanted to have digestive enzymes in the stores because it's not just the amylase, it's also proteins and fats that need to be broken down as well too. So this should be sitting next to the Thanksgiving turkey because everybody's bloated after they eat and not digesting well, so digestive enzymes. Okay, vitamin C, absolutely essential. It is so important for oxidation processes in the body. I take 4 vitamin C a day, like 4,000 milligrams of vitamin C. You do have to be careful with vitamin C if somebody has kidney stones, not to megadose too much, but it's great for the immune system, great for the skin, great for anti-aging, helping the DNA keep its structure strong, the telomeres tight, all those things that just keep us able to repair our cells instead of them being basically apoptosis, which means cell destruction over time. We do have a brain support that has ginkgo biloba and DMAE and a bunch of other components that are absolutely wonderful. It's on back order right now. It's been on back order for like a month. I just want to cry. But anyway, we do have some just straight ginkgo biloba that we're substituting for that. We have a few other things that aren't our private label in our office, but we have some hair growth. We have the follicle growth, which if you have hair loss, this works on the hormones basically, like DHT and the hair follicles that can help with regrowth. And melatonin, of all things, can help with hair growth, topical melatonin too. So we have a topical melatonin. That's our topical melatonin. So melatonin has a lot of functions. It's not just sleep. So anyway, I'm kind of sensitive to oral melatonin though, because I have weird dreams. So some people are, but this is DIM cream, which is just like the estro support that we have. It's that same diethylmendolamine, the DIM. This is great for cellulite because what happens with cellulite is that's a hormone imbalance where the estrogen's breaking down the collagen structure and then you lose that integrity in there. So DIM cream is actually, you could take it topically just like you could take hormones in a cream too. But it's really nice if you want something topical for like a issue like cellulite or something like that. We have a liver support. Actually, we've kind of done away with this. I just like this. It's a brand I've used for years. But now that we have our detox powder, it has phase 1 and phase 2 liver support in it. So if you're going to do that, you don't need an extra liver support as well. So a whole bunch of good things. This is not a comprehensive in any way, but it's a good start. Supplement Review 101. Thanks.